Senator Chris Murphy was on the Primary Concerns podcast, and he was talking about the American Health Care Act. And for those of you that don't know, that is the Republicans' plan to repeal and replace the Affordable Care Act. So he was asked whether or not, if Trump Care goes through, would Democrats consider something like a Medicare for all system? Now, his answer was really odd to me. So he tap danced around the answer. He said probably, and then maybe, and then he said, there's some caveats. So he just wouldn't give a direct answer. So let's listen, and basically I'm going to tell you what his answer is in a nutshell.
So would you support doing something expedited, something along the lines of a version of single payer? If Republicans rip apart the Affordable Care Act, and if Democrats are serious about saving ACA, why not more explicitly say, if you do this, we're going to come back and we're going to do to you what you're doing to us right now?
I think there's a lot of hypotheticals built into that question. I guess I'm not there yet as to what our ultimate legislative response would be should they pass this bill and should we win back control of the House and the Senate. I think there's a lot of steps that are involved between here and there. So my focus right now is trying to defeat this proposal at all costs. I do think you need to just think about the whiplash to the American healthcare system that comes with radical changes to it, depending on Republicans or Democratic leadership. It would be beneficial if at some point we could get some basic bipartisan consensus around the non-Medicare portion of our healthcare system, as we have historically had up until this moment around the way in which we run the healthcare for 65 and above. But clearly, if Democrats get control of the House and the Senate and Republicans rip away healthcare from 24 million people, we are going to do whatever it takes to restore healthcare to the people who had it taken away. If they actually allow insurance companies to discriminate against sick people, then they're going to lose majorities of the House and the Senate in 2018, and we will have the numbers potentially necessary in order to restore those benefits. So I haven't really thought out in my head exactly what we would offer and how we would do it, but they're going to lose control of the Senate and the House if they go forward with anything that resembles what happened in the House, and we'll have the opportunity to fix it.
This approach, this sort of olive branch approach, ends up, 6-7 years later, everyone's kind of throwing it back in your face. What's left other than to do a Democratic, liberal only, no nod to consensus healthcare bill in the future?
Well, and I think you can, further to that point, you can argue that had we done Medicare for all in 2009, it might have been much more popular and much harder to attack than the bill that we passed, which was an attempt to try to fix the underlying problems in the healthcare system while maintaining the existing platform, this mix of public and private care. Clearly extending Medicare to everyone is much more easy to explain and much easier to comprehend. As we sort of think about how we would get to that moment, I think it's probably most easy for the public to stomach if they are given the choice, right? If they are given the choice to sign up for a Medicare program or stay on their private plan, I think you would see, if they were given that choice, a pretty massive gravitation over to a Medicare for all type vehicle, because A, it would likely provide better benefits and at lower cost because of that very minuscule administrative cost built into the Medicare plan. So, had we done that at the outset, you could argue that it would have been more popular. It would have been harder for Republicans to attack, and clearly that's going to be on the table if they move forward with this repeal.
You're talking about essentially a very robust version of a public option.
I think you have to think. It's easy today to say that we should be in a Medicare for all single payer system, but you do have to think about how you would transition to that system. And when I think about that, it looks very much like a very aggressive, robust public option.
So basically his answer was no. Now, the reason why he wouldn't just directly say no, and the reason why he did this little tap dance around the issue, was because he knows that Americans are paying attention. We're calling out corporate Democrats that refuse to back a Medicare for all system. And he certainly saw how his colleagues, Dianne Feinstein, Claire McCaskill, other corporate Democrats were called out by their constituents when they refused to back Medicare for all. So he knows that if he wants to actually continue to maintain the favor that he's cultivated with his constituents, he's going to have to muddy the waters a little bit. And really, when you take a moment to think about his argument, it's just indefensible. So he states, if we did Medicare for all back in 2009, it would have been more popular and harder to attack. So when, asked whether or not you would opt for this again if Democrats can ever take back government, he said, maybe if Trumpcare passes, but I'd probably be more in favor of a robust public option. So if you admit that there are benefits with Medicare for all, if you know that it's easier to sell to the American people, and the best part is that a majority of us are in support of it, including a plurality of Republicans, then why wouldn't you back Medicare for all? And the worst part to me is that he says that it's only going to be on the table, so it's not even a definite thing. It's only going to be on the table if two conditions are met: if Trumpcare passes and if Democrats are able to take back control of the House and the Senate and the White House. But the problem is that that's not how you win, because if you don't put forward a real alternative to Trumpcare, you cannot take back the House and the Senate, because if you don't give voters a real option, an alternative, you're not going to excite anyone to get out and vote for you. We saw this strategy tank Hillary Clinton's campaign recently. So why would you double down on a losing strategy? You can't just say, well, the Republicans are evil, they're bad, they do bad things, elect us, because we're not that way. You actually have to retort with something that would better our lives, but they're not doing that here. And imagine the impact that this would have on their electoral prospects. If Democrats came out swinging right now, even if they don't have control of anything, and they said, if you elect us, we will fight for Medicare for all and make it our number one priority, and we will not stop fighting until it's passed. Can you imagine the amount of support that they would get for a system like that? I mean, it's overwhelmingly popular. 75% of Democrats support that. A majority of independents support it. You would have people come out in droves to support you because, again, we learned that voters, they don't vote against someone. They vote for someone with policy, someone with a vision for the future. And since Democrats still don't have a vision as to what their response would be to Trumpcare, it's incredibly frustrating to me, because he's saying Medicare for all is only on the table if Trump passes. Well, why does there have to be any caveats? Why can't you just say that you're going to fight for Medicare for all? We know it's because the Democratic Party's health insurance donors don't want them to. So that unwillingness to commit, it's not going to guarantee Democratic victories in 2018 and 2020, even if the GOP can push Trumpcare through Congress. Because if you don't put forward a solid vision, you won't excite the base. And when you don't excite the base, they stay home and Republicans win. So I don't understand how a sitting senator doesn't understand this. This is politics 101. You've got to counter with a policy. I mean, if you don't do that, then you're not going to excite anyone. So we already know what to do. We know that his answer is basically no. By tap dancing around it and saying, maybe, definitely maybe, it might be on the table, you're telling us no. That's what you're telling us, because we know how Democrats operate. If you're not even willing to take a stand now when you have nothing to lose and everything to gain by endorsing Medicare for all, we know your answer is no. So we are going to call you just like we called Claire McCaskill and Dianne Feinstein, because I know that you think you're going to be able to evade criticism by doing this tap dance, but it's not going to work, buddy. So his phone number is 202-224-4041.
Hello, you have reached the office of Senator Chris Murphy. We are unable to come to the phone, but please leave a message and we will call you back.
Hi, my name is Mike Figueredo with a message for Senator Murphy. I recently heard his interview on the Primary Concerns podcast, and he was asked whether or not Medicare would be on the table if Republicans are able to roll back the protections that we currently have with the Affordable Care Act. And basically, he did this tap dance, and he said it would really only be on the table if Trumpcare passes and if they could retake, the House, the Senate, the White House. And basically what I heard was that he would not be in favor of a Medicare for all system. And I know that he's trying to probably muddy the waters because he doesn't want any criticism like his colleagues have. But if Chris Murphy does not support a Medicare for All system, we will primary him at the earliest opportunity, because currently a majority of the country supports a Medicare for All system. According to a current YouGov poll, 75% of Democrats support it, 58% of independents support it, and a plurality of Republicans support it. So they have nothing to lose. Chris Murphy has everything to gain by supporting a Medicare for All system, but I'm wondering if his reluctance to support it really is more so about the $600,000 that he took from the health industry. And if that's the case, then we can't have him in office. We have to primary him and get him out of office, because we need someone who's going to represent us and not the donors. So I would like you to forward this message to Chris Murphy. If he does not support Medicare for All, he will lose the support of his base, because if you want to defeat Republicans in 2018 and 2020, you have to offer voters a real alternative. You need a vision that you could present to the American people. And telling us maybe we'll pass Medicare for All isn't going to do it. So tell him to get on board or get out of office. Thank you very much. So please call. I would encourage you to leave him a message, be polite. We don't have to be rude. We can get our point across, by just letting them know what's at stake. Either you support Medicare for All, something that a majority of Americans support, or you leave office, because you're elected to represent Americans. And if you're not going to do that, then you have to leave. It's that simple.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.